Hi, my name is Dr. Sadie Thomas-Unsworth, and I'm the lead clinical psychologist for staff support at University Hospital Bristol and Weston. COVID-19 has put our staff under significant pressure, and this pressure has lasted for some months already and will continue for a good deal longer. We know that staff working on hospital sites, be that the front line or in non-clinical roles, are more likely to contract COVID. And we're asking our staff again and again to put themselves in that situation. For many, this has and will continue to generate anxiety. Not just because of the risk to themselves, but also the risk for those they love. Frontline staff are happy to care for patients in different ways to how they normally would, wearing uncomfortable PPE, and often being unable to allow family to visit. Sadly, some staff will have also seen highly distressing events. This is really, really difficult for staff that care so deeply about their patients. Putting staff in this situation for a few weeks or months would be challenging, but our staff are having to find ways of managing this and sustaining this for an unknown amount of time. And this really does put them at risk of physical and emotional exhaustion. But the scale of the challenge for staff is much greater than that. For many staff, their roles will have changed, or they will be having to rapidly adapt to ever-changing protocols and systems. And this again is just exhausting. This doesn't just affect staff in work either, but also staff having to shield, who may be really struggling with not feeling like they know how to contribute and wanting desperately to support their colleagues. Finally, of course, some of our staff will be doing all of this in the context of returning following serious illness themselves, or after the death of a loved one. So the ask of our staff really is huge, but they will find a way of doing it, because what unites healthcare staff more than anything else is the desire to help. And this is exactly why we want to ensure that we're caring for those that are doing the caring. Working together with the support of Above and Beyond, we've been able to put together a comprehensive package of initiatives to think about staff's physical and psychological well-being. We're going to be offering staff access to check-in sessions with a clinical psychologist to discuss their well-being and look at strategies that might help. By offering this support embedded within their workplace, we can make accessing psychological support a routine part of what our staff do to sustain themselves. This will allow us to provide help quickly and prevent problems from escalating. And in addition, for those staff that do want more formal counselling or support, this will be on offer too, as part of our employee assistance programme. We know that workplace wellbeing is in large part dependent on how supported people feel within their teams. And so we're going to be working with teams as well to create spaces to come together and reflect using our new team check-in model, again facilitated by a clinical psychologist. These are just a couple of elements of the support package we're putting in. And we're doing this because we believe that staff caring for others should be cared for themselves. But not just this. We know that when staff feel cared for and supported, they are better placed to offer patients the highest standards of care. They have more energy, they feel more connected with why they do their job, and the communication within their teams is improved. Thanks to everyone who has supported Above and Beyond so far. Your support really does make a huge difference.